Hello friends, welcome once again. So now today we are here with analgesics. Today we will start studying about analgesics. As you might be knowing that analgesics are the drug that help to alleviate the pain. These are basically divided into two major groups, NSAIDs and opioids. NSAIDs means non-steroidal anti-inflammatory drugs and the other group is opioids. Acetaminophen or paracetamol is also considered along with NSAIDs, though it is not considered under the categorization of NSAIDs. Few examples of NSAIDs are naproxen or naproxen sodium, ibuprofen, aspirin, ketorolac, celecoxib, rofecoxib, mefenamic acid, and same way opioids. These are divided into natural, synthetic, or semi-synthetic. Examples are morphine, codeine, oxycodone, meperidine, tramadol. So in the coming lecture, we will be studying about NSAIDs in particular. We will study their contraindications, absolute contraindications or relative contraindications. After that, we will be studying the opioids. I am teaching you all these things because after this lecture, I will be starting with prescription part. So before we move on to prescriptions, we must know all the contraindications and indications of all the drugs, whether these are analgesics or these are antibiotics. So I am starting with NSAIDs now. Let's start with NSAIDs. What are the indications of the NSAIDs? The first indication is antipyretic. This means if a patient has fever, so get yourself relieved from the fever, patient is given NSAIDs. Pyretic means fever, so anti-fever. The second is analgesic, that is it acts as a painkiller. The third is anti-inflammatory. As indicated from the name, non-steroidal anti-inflammatory drugs. These drugs help to alleviate inflammation. So there are different severities of pain. So a patient can have mild pain, mild to moderate pain, and severe pain. We have divided which NSAID or which medicine to be given in case patient has mild to moderate or if a patient has severe pain. So if a patient has mild pain, that patient should be given acetaminophen. It acts as a first line of drug in case of mild pain. Even when it comes to mild to moderate pain, the same analgesic is given. But if a patient has severe or moderate to severe pain, then we no longer use acetaminophen. In that case, we always use the medicines that were present in NSAID group. For example, ibuprofen, naproxen, mefenamic acid, ketorolac, etc. One addition to this, when it comes to mild to moderate pain, ibuprofen is a drug that is divided into either 200 mg dosage, 400 mg dosage, 300 mg dosage or 600 mg dosage. So when it comes to mild to moderate pain, we can also give ibuprofen 200 mg along with acetaminophen. So let's revise it again. For mild pain, we give acetaminophen. For mild to moderate pain, we can give either acetaminophen or ibuprofen 200 mg. When it comes to moderate to severe or severe pain, then ibuprofen 400 or 600 mg is given. Naproxen or naproxen sodium, ketorolac, mefenamic acid, and the other drugs that fall into NSAIDs group. Now comes the contraindications of NSAIDs. The contraindications are divided into two groups. One is absolute contraindications and the second is relative contraindications. In absolute contraindications, there are certain scenarios where NSAIDs are absolutely contraindicated. Let's walk through them one by one. The first is allergy to aspirin or any other NSAID. If a patient is allergic to aspirin or anti-salicylic acid or any NSAID, then that patient should not be given any NSAID. In that case, NSAIDs or aspirin are contraindicated. The The second group is aspirin-induced asthma and nasal polyps. In this case, aspirin is contraindicated, but if in the medical history we are given in question that patient has aspirin-induced asthma and nasal polyps, then NSAIDs are also considered absolutely contraindicated. Third is gastrointestinal disease. For example, peptic ulcers, duodenal ulcers, or if a patient has inflammatory bowel disease, in that case, NSAIDs are contraindicated. But if a patient has GERD, that is gastroesophageal reflux disease, then NSAIDs are not at all contraindicated. The next group is bleeding disorders. For example, von Willebrand's disease, hemophilia. So if a patient has hemophilia, then NSAIDs are considered absolutely contraindicated. Next is pregnancy. In pregnancy, only the third trimester, that is the last trimester, NSAIDs are considered contraindicated, but not in the first and the second trimester. So always remember that in pregnancy, only third trimester, the NSAIDs are considered contraindicated. Next group is if a patient has severe renal or liver impairment, for example, end-stage renal disease or end-stage liver disease or cirrhosis. Next group is medications. So if a patient is concurrently taking lithium or methotrexate in the dosage of anti-neoplastic dosage, because methotrexate is used in other uses as well, but when a patient is taking methotrexate in the dosage of anti-neoplastic dosage, only then it is contraindicated. Then is digoxin. Digoxin in older individuals only. And then is anticoagulants. Anticoagulants, for example, warfarin, dabigatran, etc. In addition to these absolute contraindications, there are two other absolute contraindications that are specifically used only for aspirin. First is if a patient is taking oral sulfonylureas as hypoglycemics. And second is if a child has influenza or flu-like symptoms, in that case, that child should not be prescribed aspirin because that can lead to Reye syndrome, which is a fatal syndrome, and that can lead to severe damage of the brain of that particular child. So here we have discussed absolute contraindication of NSAIDs. The second group is relative contraindications. Relative contraindication means if NSAIDs are given less than or maybe equal to 4 days, then it's fine. But if the patient is given more than 4 days NSAIDs, then it becomes absolute contraindication. So the examples are if a patient has history of myocardial infarction or stroke, and the second group is if a patient has been taking ACE inhibitors, for example, enalapril, captopril, lisinopril, loop diuretics, for example, furosemide, ethacrenic acid, bumetanide, beta blockers. These can be selective or non-selective. In case of heart failure or if a patient is taking it for any cardiac condition, in that case, if the patient is taking NSAIDs for less than or equal to 4 days, then it becomes a relative contraindication. But the moment medicine is given for more than 4 days, it becomes an absolute contraindication. Let's move on to opioids now. So the indications for the use of opioids are analgesics. It acts as a painkiller in severe pain. Then is antitussive. If a patient has cough, then it can be used as an antitussive. Then is antidiarrheal. If a patient has diarrhea, opioids have an indication in that case as well. Then are the contraindications. The first one is severe respiratory disease. In severe respiratory disease, we have examples like severe COPD or chronic obstructive pulmonary disease. or severe asthma. Guys, one thing to remember in this case, if in a given question you are given severe word, only then it becomes a contraindication. Otherwise, don't consider opioids to be as a contraindication. Then is severe inflammatory bowel disease. Here also you have to look for this word, severe. If in the medical history, severe word is not given prior to inflammatory bowel disease, in that case, only NSAIDs are considered contraindicated but not opioids. Then we have if a patient is concurrently taking alcohol or CNS depressants. If the patient is not taking them concurrently, that is at the same time, then this group is no longer considered to be a contraindication. Another group is addiction or substance abuse. So if a patient is addicted to opioids, or if a patient is on substance abuse, or patient has a history of substance abuse, then opioids are contraindicated for that patient as well. Then there are two contraindications that are not for particularly for the opioids group, but it's for meperidine, which is a synthetic part of the opioids. So we do not prescribe meperidine if a patient has taken monoamine oxidase inhibitors in the past 14 days. So if a patient has taken monoamine oxidase inhibitors in the past 14 days, then meperidine becomes absolute contraindication in that patient. One thing more, codeine is not allowed to be used in patients under 12 years of age in Canada. So if a patient is given codeine whose age is less than 12 years of age, then in that particular case, the codeine becomes absolute contraindication. Here are some important points regarding opioids. The first point is, if a patient is allergic to codeine or any other natural opioids, then all of the natural opioids, for example morphine, or semi-synthetic like hydromorphone or oxycodone, these are also considered contraindicated in that patient. In that case, we can give synthetic opioids, for example pentazocine or fentanyl. The second point is, when a patient has severe pain and NSAIDs do not alleviate the pain, in that case we can add acetaminophen or any NSAID to codeine. So basically the combination of opioid and NSAIDs is used in the case of severe pain. Third point is, codeine, it takes the priority in case of opioids. After codeine, you can go with oxycodone, but always codeine to be used first in combination with acetaminophen or NSAIDs. If the patient is by any reason cannot take codeine, only then we can go for oxycodone. For example, in a breastfeeding mother or in a pregnant lady, if we want to give painkiller in her third trimester for severe pain, then oxycodone is considered a better choice over codeine in combination with acetal. So in this case, oxycodone is a priority and codeine is not a priority. But in all other cases, codeine takes priority over oxycodone. Let us now discuss analgesics in pregnancy. So guys, as you can see, I have divided it into two groups, first and second trimester and third trimester. In first and second trimester, when a lady has mild to moderate pain, then the first choice is acetaminophen. If the severity of pain is more, that is the pain is moderate to severe, then patient is given NSAIDs. If patient cannot take NSAID, only then we have to give oxycodone. Now let's move on to third trimester. So if the lady has mild to moderate pain, in that case the first choice is acetaminophen. In moderate to severe pain, as you remember, that NSAIDs were contraindicated if you remember it from the absolute contraindication list. So in this case, the first choice is oxycodone. So guys, always remember these tables because these will help you in solving the prescriptions that you are given in ACJ exam.